Patrick is a 78-year-old gentleman who is suffering from the worsening of his left-sided heart failure and chronic obstructive pulmonary disease. Factors influencing Patrick's respiratory symptoms of dyspnea and coughing are caused likely by his lifestyle and age. A diagnosis of COPD is considered as the symptoms of cough and dyspnea. His symptom of cough is associated with the production of small amount of sticky mucus. Patrick has predominance of chronic bronchitis, which is evidenced by his regular coughing. According to Patrick's medical history, he was a smoker since the age of 20 and quit his smoking in his early 60s. According to our research, quitting smoking after the age of 45 gives higher chances for the progression of COPD. Smoking approximately for 40 years has exposed his lungs to toxic gases including carbon monoxide and other chemicals causing damages to the lungs. This toxic gases is including carbon monoxide constrict the bronchi, paralyzes the cilia, thicken the mucus secreting membrane, and also ciliate and distal airway and destroy the alveolar walls. Aging is another important factor that leads to respiratory complications. Patrick is a 78-year-old man. His aging results in changes in his lung structure and respiratory muscle. As Patrick's age, there is a gradual loss of his elastic recoil of the lungs, thus causing lungs to become more rounded and small. Moreover, the number of functional alveolar supporting structure and loss of the intra-alveolar spectrum causing him to have dyspnea. Factors contributing to Patrick's heart rate are smoking caused by his risk of COPD and anemia due to decreased hemoglobin. Patrick's heart rate is 155 beats per minute, whereas the normal heart rate is 60 to 100 beats per minute. Smoking cigarette is a major risk factor for the increased heart rate, causing the development of chronic obstructive pulmonary disease. The effects of carbon monoxide in cigarette smoke, combined with those of the nicotine, cause an increased risk of coronary artery disease. Carbon monoxide has a high affinity with hemoglobin and combines with it more readily than oxygen, reducing oxygen carrying capacity of the lungs. Smokers also inhale less, reducing oxygen capacity, and they also inhale carbon monoxide, which they exhaled, adding to the decrease in available oxygen. Together with the increased myocardial oxygen consumption that nicotine causes, carbon monoxide significantly decreases the oxygen availability to the myocardium, thus resulting in increased heart rate. Another important factor that contributed to Mr. Patrick's increased heart rate is his decreased hemoglobin, causing him to have increased heart rate. Anemia is defined as a decreased concentration of hemoglobin. And this is relevant because hemoglobin is virtually the only way for oxygen to be taken up and transported in the blood. Anemia therefore threatens to cause hypoxia at the tissues, therefore affecting heart rate. Due to the decreased number of red blood cells present in the circulatory system, the heart pumps faster to circulate the available red blood cells more quickly throughout the system to keep the cells alive, thus increasing the heart rate. Another contributing factor is the Patrick's past history of congestive heart failure, which causes insufficient cardiac output to the systemic cycle as the blood flow to the brain, heart, and lungs is prioritized. The perfusion reach in kidneys is less. If the kidneys are detecting decreased blood volume, even if the blood volume in everywhere else in the body is sufficient, then the renin-angiotensin system is activated, leading to an increased blood pressure and volume. This means that the heart has to work hard to pump the excess blood out. Chronic obstructive pulmonary disease. The airflow limitation is usually progressive and associated with abnormal inflammatory response of the lungs to noxious particles or gases. In the case of Patrick, his primary cause of COPD is his past history of cigarette smoking. Patrick smoked for approximately 40 years, and although he ceased smoking 10 years ago, the damages are unfortunately progressive and irreversible. The development of COPD is the result of damage to the airways. Cigarette damage the alveoli walls, breaking down the elastic fibers, which makes it difficult for the lungs to recoil. The cilia is also damaged, impairing the function of keeping the airways clean. However, the exacerbations of COPD are signaled by a patient's dyspnea and cough. With the increasing frequency of dyspnea and cough, the disease also progresses. The primary cause of exacerbations of COPD is smoking. Left-sided heart failure. Patrick had a myocardial infarction, also known as heart attack, at the age of 65 to a branch of his left coronary artery, which is caused by his past years of smoking. Heart failure is not a disease. However, it is associated with numerous types of heart diseases, particularly with long-standing myocardial infarction. His left-sided failure resulted from left ventricle dysfunction, which causes blood to back up through the left atrium and into the pulmonary veins. The increased pulmonary pressure causes fluid extravasations from the pulmonary capillary bed into the interstitium and then to the alveoli, which is manifested as pulmonary congestion and edema. Patrick's diagnosis in COPD developed independently as the result of his smoking, whereas his left-sided heart failure is the result of his myocardial infarction that he suffered, which may also have been a result of his history of smoking. Patrick's COPD would have caused his left-sided heart failure, but certainly would have worsened the condition. COPD results in low levels of oxygen in the blood, which means that blood is not being oxygenated properly. This leads to give extra pressure on the heart as the heart now has to work harder and pump faster to deliver oxygen around the body. However, this worsens the condition of his left-sided heart failure. Patrick's risk of developing right-sided heart failure. COPD can lead to right-sided heart failure. The primary cause of right-sided heart failure is left-sided heart failure. Left-sided failure results in pulmonary congestion and increased pressure in the blood vessels of the lungs. Eventually, chronic pulmonary hypertension results in right-sided hypertrophy and failure. Because Patrick had suffered left-sided heart failure, blood accumulates within the pulmonary circle, making it difficult for the right side of the heart to eject its blood output, and this in turn can lead to the development of right-sided heart failure. The constriction of the pulmonary vessels in response to the alveolar hypoxia, with the acidosis further potentiating the vasoconstriction, resulting pulmonary hypertension, which places excess strain on the right ventricle and increases the workload. The right ventricle expands in size and is overworked. It eventually becomes weaker and loses ability to efficiently pump blood to the lungs. In the long term, this can lead to the development of right-sided heart failure. This process is called cor pulmonale. Patrick's blood results shows that he has electrolyte imbalances, which is hyponatremia, hypokalemia, and hypercalcemia. The contributors to his condition is the electrolyte imbalances. Electrolyte imbalances in elderly are caused by impaired renal function. The impaired renal function can be a result of his kidney disease, which manifested from his cardiac disease and smoking. Hyponatremia. Patrick's elevated sodium shows that his kidneys are reabsorbing sodium then required by his body, causing deficit of total body water to total body sodium caused by water intake being less than water losses. Due to an osmotic shift of water out of the brain cells, including confusion, neuromuscular excitability, seizures, and coma are primary neurologic outcomes. Hyperkalemia. Patrick's elevated potassium level shows hyperkalemia. This can lead to affect his muscular and cardiac function. Since potassium is one of the main electrolytes that is involved with action potentials of neurons, hyperkalemia can cause distress in neurological function. Hypocalcemia. Hypocalcemia is an essential electrolyte for neurological function. Hypocalcemia may lead to syncope, congestive heart failure, and angina due to the multiple cardiovascular effects. Neuromuscular and neurologic symptoms may also occur. Neurologic symptoms of hypercalcemia include irritability, impaired intellectual capacity, depression, and personality changes. Patrick has also dyslipidemia evidenced by his increased level of LDL and decreased level of HDL. Dyslipidemia is caused by his diet, sedimentary lifestyle, and smoking. This is a very risk factor for ischemic stroke. Similarly, the contributory factors of Patrick's high glucose is his diet and lifestyle. The high glucose in the blood will cause him to have damage to his neurons. Moreover, low hemoglobin in Mr. Patrick is also caused by COPD and ventilation mismatch. This can result in altered sensory perception and cognitive impairment. The additional blood test which could be taken from Patrick was the test for pH, which gives results of blood acidity. The normal pH is 7.35 to 7.45. It is expected that Patrick's pH would be low due to his acid base imbalance.